Thank you. Wow, I just sitting here trying to think we're splitting hairs over the word fraud when what's going on in Minnesota, what's going on in Los Angeles. Gosh, if that doesn't undermine confidence in the system, nothing else does. And do we not call it fraud because it might undermine confidence in the system? It's, $14 billion being taken. People identity being stolen on Medicare or seniors, so when they go to get the product that they desire, that they deserve, they can't get it because somebody's gotten paid for it under their name. I mean, my goodness, we're going to try to redefine the word fraud to not include that. I'm not sure why we're sitting here. It's just dumbfounded. So, Ms. Gay, the things that you've seen that we're talking about in Minneapolis, that's happened in Minnesota, and what happened in Los Angeles, would you define that as fraud? Aren't these people purposely setting up fake accounts so they can get money and not serving anyone? I think that would have to be fraud. I don't think that's improper.
Interestingly, so I can never, we don't use the F word often is what I say in my line of work because I'm not law enforcement or, can't, speak for the law. However, it is hard not to see fraud when there's very clear intent. Proving that intent is often what is difficult.
Okay. So, Ms. Wood, in your organization, you have people that are police. You have your law enforcement. So, would you define these? What you're seeing in Minneapolis and what we've seen with the Somali population, particularly, and in Los Angeles with domestic medical equipment? Would you define that as fraud, or is there some kind of law school term we need to use to try not to call people fraud when they're being fraudulent?
Yeah, given that the information I have about those states is what I've read in the news, it's difficult to address those exact investigations. However, Medicaid fraud control units look at fraud, and we call it fraud. We do not have authority to look at waste and abuse. We are specifically designated. People refer to us a case, and they say, here's a credible allegation of fraud. Or we data mine and find what appears to be an outlier. We only pursue investigations if we think they're credible. But we do learn from other states, and yes, the schemes that we see there, we see schemes in our own states where it's definitely fraud. Companies, like I said before, set up with the sole purpose of committing fraud. Substance use disorder providers who never had a real provider provide services, even though they're so desperately needed. But I think in this conversation, we're fortunate that we focus on fraud, we call it fraud, we prosecute and litigate fraud.
So it's fair. I had a physician one time show me that he had Medicaid money, Medicare money reclaimed because he didn't put the time down. He did the service, although he did the service, just didn't have the paperwork. Absolutely correct. That's not what we're talking about. That's absolutely not what we're talking about here, is it?
Absolutely. I get.
We're talking about foreign entities in some cases setting up dummy accounts to take money out of the Medicaid and Medicare system, which seems like everybody in this room would want to get rid of because it takes money away from people who really deserve it. And I understand why we're splitting hairs on a definition when we have this kind of crime going on. So would you like to talk about, Ms. Gay, too, as well, people setting up these entities just to take money from the taxpayers?
Yes, and I'd want to say absolutely we do see some of the frauds you're describing. We also see domestic individuals stepping in who are not appropriate. They're not providers, and they're billing Medicaid and Medicare. So we see it across the gamut. But yes, it harms the system.
So how do they set up systems to get money if they're not providing care?
So they use.
I asked that rhetorically because I know they do it. So what are they doing?
Okay, so they set up a company. You don't necessarily have to be a healthcare provider to own a company, home health agency, substance use disorder clinic, nursing home. And then maybe some of the people at the lower level are doing what they think they're supposed to do as services. But the reality is those lower level people don't know what the Medicaid regulations are and the Medicare regulations are. And so the people who are supposed to be billing and knowing the process and who signed the provider agreements, there are no therapists involved in some of these behavioral health schemes.
So if we're billing for therapy and you don't have therapists, would that be fraud?
Absolutely is fraud.
Ms. Gay, would you agree that would be fraud?
Absolutely.
So what are you seeing? It looks like that's what this hearing's turned into, trying to define what fraud is. And I think fraud should be prosecuted.
Absolutely. And so our role, so most of the work that I do is directly for the MCOs and MA plans, and they work then with law enforcement to refer these and to get the official stamp of the fraud.
Do you
work
see
on
more
the
fraud in states and Medicaid particularly that don't have MCOs or Medicaid managed? If it's just bill for service Medicaid or Medicare, do you see more fraud in that versus when the private insurance market is trying to
I
chase the
see a
money
lot of MCO fraud, a lot.
across all of
Yeah, and not the plans committing the fraud, let me be clear. But we see a lot in the states that we're working with that is through the managed care organizations and the difficulty to stop those. But it is, many of the cases that we are working now are with law enforcement and are being prosecuted for such things.